So I grew up in rural Kansas. I was born and raised in a town of less than 2,000 people. And then I moved around a little bit, spent some time in Oklahoma City where I eventually moved back to Kansas. And when I was in high school, my mom worked at the hospital and she was a secretary for one of our local PCPs. Kind of got me interested in the medical field. I don't have any doctors or anything in the family, so applied and was fortunate to go to the University of Kansas for medical school. When I went into medicine, I thought I was going to do pediatrics or pediatric oncology, but it wasn't until I did my rotations in surgery that I really enjoyed spending time in the OR and operating. I didn't know what field of surgery I wanted to do right away, so I applied in general surgery. I was fortunate enough to be able to do a rotation. I spent some time at Hopkins and at Temple, just kind of learning more about the field of plastic surgery, and had an interest in, so I applied for plastics, where I eventually wound up at the University of South Florida in Tampa for 3 years doing my plastics fellowship. You get to operate on so many different areas of the body. Like, you can spend a whole day in the operating room and you can be working on the face with one patient, and then you can be working on the abdomen or the breast with another patient. A lot of what you do in plastic surgery, the patient can visualize it, so a lot of the things are superficial to where the patient can see what you've done, and you can really have a dramatic effect on someone's self-esteem or really make them feel whole again. So you can really change someone's life in a positive way with plastic surgery. Beebe, the main thing that I'm focusing on, I kind of call it the 3 heads. So I'll be doing a lot of the breast reconstruction. I enjoy doing cutaneous oncology, so I know especially down at the beach, a lot of people spend time outdoors. I enjoy taking care of skin cancer and taking out the lesion and closing it up and making it look nice. Patients that undergo bariatric surgery and do a wonderful job losing all this weight, and then they have all this excess skin, do a lot of the skin removal that patients are having difficulty with after they lose a lot of weight. My wife was born and raised in Delaware. All of her family's still in Delaware, so knew that this is where we wanted to come back to. And I just was looking for opportunities where I could do what I was passionate about, and do the kind of procedures that I really enjoy doing. You don't have many plastic surgeons down here to provide care to the patient or to the population of Sussex County. Women are unfortunate enough to develop breast cancer. They undergo their treatments, but the number one cause them not to get reconstruction is access to a plastic surgeon. So it's a disservice to have to drive all the way north to Newark or Wilmington to have your reconstruction, and not have to at the same place that you had your mastectomies or your lumpectomy. So I think it's extremely valuable to the patients of this county to have access to a plastic surgeon. And it's rewarding to bring that here. I really want my patients to understand what we're doing so that they have a good understanding of what is actually entailed with their breast reconstruction, or if we're doing a flap, what it really involves and kind of the recovery from that. You're working with pediatrics all the way to the end of life, so you get to really have a very diverse patient population. I think it's kind of rewarding to be a plastic surgeon because you get to work with patients of all different populations. I am Dr. DaKota Urban with Beebe Plastic and Reconstructive Surgery.